Good morning, everyone, and welcome to the weekly COVID-19 media briefing. I'm Kerri Schuette, the Public Information Officer for the COVID-19 response. We'll start, as always, with the numbers. We have 209 confirmed cases, including 6 from yesterday. We've run 16,511 negative tests to date. We've done a total of 16,720 tests. We have 4 people hospitalized in Shasta County, including 3 in the intensive care unit. We have 30 people in isolation, and as a reminder, those are people who have tested positive and are still in their infectious period. And then we have an additional 146 people in quarantine, and those are people who have been identified as close contacts of people who have tested positive. We have had 6 deaths at this time. That's a total of 34 active cases. That's the people in isolation plus the people in the hospital right now. We'll do a round of introductions and all of you to share any updates you might have, and then we'll get into media questions. And if there's still time left, we've got a few questions from the public that we would like to share if time allows. From the county side, we have Matt Pontus, the CEO of Shasta County. We've got Donnell Ewert, he's the director of the Health and Human Services Agency, and Dr. Karen Ramstrom is our health officer. From our hospitals, we have Mark Mitchelson from Shasta Regional Medical Center and Robert Folden from Mercy Medical Center, Reading. I think that's everyone that I see. Does anybody have any updates they would like to start us out with?
Good morning, everybody. I thought I could just do an overview because I'm sure it's on everybody's mind about the governor's press conference on Monday and what they're calling the dimmer switch and how they're addressing counties that are on the county monitoring list. So just to revisit that, so the state is monitoring a number of indicators that are indicative of what's happening with transmission and, for example, real emphasis on hospital capacity in communities in order to determine what we call non-pharmaceutical intervention and closing of higher risk venues. And so Shasta County is not on that list, but on Monday, the governor announced that because of the increase in cases statewide and affecting essentially across the board the state and more and more pressure on the healthcare system, that even if you're not on the county monitoring list, there's a handful of closures that are in effect now. And some of those limited to outdoor activities only, and others are completely closed. So the closures include brew pubs, breweries, bars, and pubs, which are closed to both indoor and outdoor services unless those entities offer sit-down outdoor dine-in meals, and then open only to outdoor activities include dine-in restaurants, wineries and tasting rooms, movie theaters, family entertainment centers, zoos, museums, and card rooms. As I mentioned, Shasta County is not on the watch list, and so the additional closures do not apply to us. We're monitoring that data regularly, and to see if we're approaching that list, and we kind of go up and down, and so don't have concerns about that at this moment, but don't want to get on that list. And so the more that we can do in terms of prevention in our community and having our community members engage in physical distancing, wearing masks as required by the state to protect yourselves and your family members, and staying home if you're sick and not, gathering with people who are outside of your household is still strongly recommended, so we can avoid getting on this list and to prevent infections, additional hospitalizations, and deaths in our community. And that's all I had this morning.
Thank you, Dr. Ramstrom. If you wanted to look at the watch list, you could go to shastaready.org, and then in the first little block of text, it has a variety of links. One of them says county watch list and where are we on the county watch list, and those will take you to the state pages that are keeping track of those things if anybody wanted to take a look. Do we have any other updates before we open to media questions? 3, 2, 1. Okay. It sounds like we are ready for media questions. Do any of you have anything for us?
Yes, but go ahead, Mike.
Either way, Steve. I just had a couple quick things about the restaurants, kind of. Do we know of any examples of the COVID being spread at any local restaurants, any Shasta County restaurants?
So, not to my knowledge, but we have a large percentage of our cases where individuals don't know where they've actually acquired the infection. And so I think the concern, we do know about transmission actually in situations where people have been having a meal together, not necessarily in restaurants. And so I think the concern there is if you're not able to physically distance and you're sitting down with somebody and you're within 6 feet, then when your mask is off because you're drinking or you're eating, that's when it's possible to transmit. And so, so that's what I would say is that oftentimes a person can't tell where they were, where they might have picked it up.
Do we know, we've already done a couple stories with restaurants saying, no, we're staying open. All right, the sheriff is conspicuously absent once again today. Is there any kind of enforcement? Are we still doing the education? What do we do about restaurants who are just saying, no, I can't afford to close again? Anybody?
Oh, this is Donnell. Well, once again, we're calling on people to voluntarily comply with the governor's order. It is the law of the land. In addition, we do know that some of the state agencies are going to be doing enforcement, especially around bars and restaurants that serve alcohol. So, those activities will be going on. We are planning to convene our law enforcement partners soon and have another discussion about our enforcement actions and what measures we might take locally. I think our desire, of course, is to work with businesses to facilitate their ability to function and produce the revenue that they need, both for their own livelihood as well as those of their employees. So we're going to be trying to work with them. For example, with restaurants, there are other options for restaurants, and our cities are trying to make it simpler for restaurants to serve outdoors, and we want to try to facilitate that sort of activity. The evidence is that these indoor exposures are the most risky, and so we're trying to reduce risk by doing that. But of course, we want to try to do so without damaging the business activity as much as possible.
Thank you. One more. How are we doing away from restaurants? How are we doing in the delay for test results? How is that going? Is it getting any better, worse?
Yeah, I would just say that, it seems to be variable, and I'm not sure exactly why. So, for example, at the state testing site, we had been hearing over the last couple of weeks kind of an increasing delay in getting test results. And then this week, people are getting them back pretty quickly, and others it's delayed. And part of that might be, well, I think it's a variety of things. Definitely the test reagent shortage is not helping us. The other thing that can happen too when a test is run, if the initial run comes up inconclusive, that same specimen is rerun. And I think when an individual's case is delayed and other people seem to be getting it back quicker, I think that can be the case in those situations. So this week it seems to be good from what I'm hearing at Shasta College, but still continues to be an issue overall.
What is good? Like within a couple days?
Yes, between 2 and 3 days. I actually had my results back in about 2.5 days from Shasta College the last time I went, and then I had a specimen collected on Monday, so we'll see how it goes this week.
Thank you.
Yeah, I was confused about the state Health and Human Services statement yesterday about testing and the prioritization of testing, and wondering if that will affect Shasta County's ability to test asymptomatic people. Was I the only one confused by that statement yesterday?
We're still digesting that as well. I would say, I guess overall, the focus is trying to ensure that there's faster turnarounds for symptomatic individuals because it could impact isolation, quarantine, and medical management. And so that's kind of the overall goal, as well as with these shortages of supplies, especially the test reagents in the labs. Making sure that they're pushing through tests for people who are symptomatic is the priority. So that's my understanding at this point.
Also, follow up on the line of questioning Mike was making there. Has the state alcoholic beverage control, have they discussed pulling liquor licenses from some of these businesses that are remaining open? I'm not sure.
Right, they're doing their job, and so they are kind of making their rounds, and I think responding to complaints and also doing some proactive visits to businesses to make sure they're complying with the state requirements.
Other questions?
Hi, it's Anna here from Action News Now. I just want to follow up that, kind of going back to the whole restaurant thing, either for Donnell or Dr. Ramstrom. So, Donnell, you mentioned state agencies, so I understand ABC might be one of them. Are there any other state agencies that will be participating in this enforcement?
Well, I do know that ABC is one of the agencies. I don't know if there are others. That would be a question that state officials would need to answer.
Thank you. And then to follow up on that, will there be repercussions in the future? Because like you mentioned, you said you will be talking with your law enforcement partners. Do you see citations being handed out, fines for in the future?
Well, we haven't met with them yet, so I'm not certain. I think that I want to consider the range of options. Again, our preference being that folks, comply with the order and recognize that they can do their part for the community and look for alternative ways to conduct business.
And just to be clear, there are no repercussions or fines or penalties at this time for businesses.
It is a misdemeanor to the fine to violate the order, so that there are potential consequences. To my knowledge, there has been no citation made of any individual yet here in our county.
Yeah, and I would just add to that also, depending on the type of business, there could be licensing for a certain kind of profession. And so that's another place where there could be some intervention for an individual's license by a licensing board. And I guess I would just say that I think a lot of businesses are actually doing the right thing and really taking steps to ensure that their businesses are safe, and it's in their best interest to do so for their workers and for their customers. And so we're continuing to try and work with businesses to help them to do that and to be successful, because we're in this for a while, and so this is just the way we need to go about things. If we want those businesses to thrive and stay open, that's kind of where we are. I would say that's really needs to be the focus, not necessarily penalizing businesses, because we want them to be able to be open. And if you go to a business and you feel like that they're not doing what they're supposed to be doing, I would raise it with their management. And if you're not comfortable, I would vote with your feet and not go there, because it could be risky. But really trying to encourage businesses to be able to implement these prevention measures, because they don't really have another way of being sustainable without doing that for the foreseeable future, because this virus is here and until we actually have more medical and prevention measures in place down the road.
And I guess I'd like to add that, I'm wearing this mask today. I'm by myself in my office. I don't need to wear this mask in this setting. I'm just wearing it to remind everybody that this is our main tool right now to fight this virus. This is something anybody can do in our community, and this is the main tool that we can use to support our businesses. I've been in a lot of businesses that have signs up on their doors asking people to wear masks when they come into their business, and there are some people that follow that request and others that don't. And the people that don't are putting that business at risk of having transmission occur in that setting. And we know that things can get worse. We know that there are watch list counties where there's even more restrictions than what we're experiencing in our county. And we want to try to keep things the way they, we don't want to end up on the watch list. We'd like things to be less. We'd like to have fewer cases, but we definitely don't want more. And, as far as public health measures that we talk about a lot, some measures we ask, we advise people to do, and those things protect them individually. And there's other things that we have, public health measures, that the action actually protects others. And then there's measures that people can take to protect themselves and others. And, an example of something that protects yourself is wearing a motorcycle helmet. Okay, you wear a motorcycle helmet, you have a crash, it's protecting you. It's not necessarily helping anybody else. Staying home when you're sick doesn't really do much for you, but it does help others. Wearing a mask actually helps you and others. And so that is, again, a valuable tool, and one we're asking everybody to participate in. It is not a political statement. It is merely a way to help your own community fight the virus.
Other questions?
Yes, I have a question. I see in your report that you have a number of young people who have been diagnosed with the virus, and I'm wondering how young how young is the youngest individual, and is that concerning? Oh, and I guess concerning not for that individual, but just the number of people who are under the age, I think it is of 13 and under, just if the numbers of people in that category is concerning.
I think it's concerning because these children are either going places where maybe people aren't taking these prevention measures, and presumably if they're young children, that's with their families. And so I would say that many of our young people have acquired infection through travel. And so that's not a good idea right now. And sometimes travel, though, has to happen for emergency situations, and in which case, we recommend doing all you can to protect yourself and your family in those circumstances, really emphasizing physical distancing and wearing a mask. We're not really, haven't had enough children to give additional age ranges. That's something I think, if our number of kids go up, we could think about maybe breaking that down further, but we haven't done that thus far.
Okay, thank you.
Other questions?
Hi, Anna here again. Sorry. Dr. Ramstrom, I just want you to clarify something for me. So when it comes to the restaurants, so can restaurants still do the dine-in if they're offering outdoor services like outdoor patio, but they can't exactly dine in inside of the building, correct? I just want clarification on that.
Right. So here in Shasta County, restaurants can continue to do either takeout or they can provide meals outdoors.
Okay, thank you for that. Appreciate it.
Other questions from the media? Okay, I have a few questions from the public. The first one looks like it's probably for Dr. Ramstrom. Why is herd immunity being discounted for achieving immunity from this strain of virus when there are little to no symptoms in many cases? Is the plan to mandate some vaccine, assuming one becomes available to achieve the 70% immunity target?
So we're not discounting herd immunity. We are looking forward to herd immunity, to be honest with you. But at this stage, just based on this, because we don't have any immunity except for the, little over 200 people who've been diagnosed, and then likely an additional, probably additional people that are asymptomatic that we haven't diagnosed. So we could do that math and kind of figure out what that number is. Still not a large percentage of the 180,000 population here in our county. So if right now, if all the people who are susceptible got infected, we would have our hospitals overrun with thousands of people, which is not feasible. And so we want to slow that infection rate until we do have a vaccine. My sense is the vaccine is going to be rolled out in a way that's going to target different groups. There's a variety of different kinds of vaccines in development. I think some of the initial groups that's going to be offered to would include healthcare workers to protect our healthcare workforce, as well as people with health conditions or who are older adults, so that we make sure that they are protected. And so I think it's probably going to be kind of a stepwise rollout of different types of vaccines. And so that's yet to be determined based on how the research progresses and what comes out first. So that's yet to be determined.
All right, thank you. Sorry. Thank you, Dr. Ramstrom. The next one is, I'm curious what, if any, new treatments are being used with COVID patients. It seems the death toll has dropped significantly since the peak, despite cases going up. How have treatment options progressed since we first learned of the disease? Are we making some progress? And if so, is it significant? That was a lot of questions in one question. Is that a good question for our hospital folks?
I'm no physician. I know that we are using one drug, remdesivir, and that appears to have been pretty effective for the few patients that have received it, but not that I'm aware of. But again, I'm not a physician. So Dr. Ramstrom, I'll turn it over to you.
Yeah, so that's actually been on my mind too, to kind of loop back and see for the handful of patients, as Robert said, that we've been able to provide remdesivir to see did it shorten the length of stay, that kind of a thing. The research shows that it does. And then, as you may know, there's a commonly used steroid that's has been shown to decrease mortality, actually. And so I think nationwide, I think those two medications may be making a difference. I haven't seen any compilation or population data on that yet. We look forward to when there's remdesivir supply improves, hopefully in the coming months. Right now, there's a limited allocation that is distributed to each state based on their hospitalizations. And so we've here in Shasta County been able to receive some of our own allocation. It's just a handful of doses. And then we have been able to get some medication, some remdesivir from surrounding counties. And similarly, we have provided some. And so I think it is having an impact. Unfortunately, the limited supply of remdesivir, the impact on overall morbidity and mortality, I think is going to be not having maximum impact right now, just because the availability is so limited.
All right, thank you. Some patrons of businesses are saying that businesses are refusing service if the customers are not mask wearing. The guidance, there's a quotation from the guidance, and the guidance says that if 6-foot social distancing is maintained, the section says a mask is not required. Lots more quotation from the guidance. Said another way, if you can physically distance, a mask is not required according to a piece of that guidance, which is kind of conflicts with the face covering guidance. So the question is, can businesses refuse service to those who are not wearing a mask?
I would say a business can do whatever they want. I think, and you know, if they're worried about their workers or their patrons being exposed, then they certainly have the latitude to do that. I would just say that the intention of the guidance, the mask guidance in particular, and the other industry-specific guidances are really to focus on especially indoor spaces where if you know that you wear a mask, or if you're in public, because you might not be able to control people around you. Physically distancing yourself and wearing a mask are additive, and so both of those are recommended, in many instances required in terms of the mask use at this time.
Okay, there are a few questions about statistics that I can actually answer offline. And then the last one would be, does the county plan to limit intercounty travel? Is that a decision that's up to us?
Well,
Might not be.
the governor's order does say that people should not do non-essential travel. In other words, if you have to travel for work or some family emergency, that's allowed, but we're not supposed to travel for vacation, recreation, and so forth outside of our county. So obviously difficult to enforce, and we are again relying on people using common courtesy and voluntary compliance with that that part of the order. You know, again, the reason for this is the more people intermingle, especially going from high incidence areas to low incidence areas, the greater the risk of transmission. And we have had a lot of cases, either individuals who have been infected elsewhere and come back to their community, or we've had visitors from other communities come, stay in their homes, and transmit in that setting. So we do very much exhort our residents to follow that part of the order. That is another important thing you can do for your community. Stay close to home this summer. Explore all of the wonderful tourist attractions we have here in our county. Support our local businesses and attractions, and protect your community that way.
All right, thank you, Donnell. Did any other questions come up for the members of the media? Michelle, looks like yes.
Yes. I had a question for Dr. Ramstrom. Where do you stand on school reopenings next month, given what's going on with the rising cases, including in young people?
Yeah, so we have been working really very closely with the Shasta County Office of Education, and they have been working for weeks with their superintendents to develop plans. The California Department of Public Health and the California Department of Education have both come out with guidance. The CDPH guidance is going to be updated this week in light of the increase in cases since that came out not too long ago. And you know, I think we all recognize the value of having kids in school. So the task is to figure out how to do that as safe as possible. And so I think these recent closures by the governor give us an opportunity to support our children to be in school. Some of these situations might have to be hybrid models depending on the capacity and layout and space in each individual school. And so each school is developing their own plan about how to implement the elements in the guidance and protect both the kids, the students, and staff, including the teachers. And so I think what is reassuring is that we know that child-to-child transmission is less common in younger kids, as is child-to-adult transmission. And so that's reassuring for younger kids where it may be more difficult as far as you know, 100% all the time mask use, that kind of a thing. And so we'll see what the updated state guidance looks like when it comes out later this week. But we're in full support of schools on getting kids back into the classroom as much as possible and as safe to do. And I think it's a, I would just, also say to the community, the more you can do in terms of prevention to prevent yourself and your family from becoming infected, the more likely our kids are going to be able to successfully get back in school, and which is really, really needed and is a huge benefit to them on multiple levels.
Okay, thank you.
Any other media questions? Okay, did anything else come up for any of our panelists? Hearing, oh, Donnie, looks like Donnie has a green light. Not hearing Donnie's voice. We had it fixed last week, but not so much this week. Okay, so Donnie, I'm going to ask you to maybe send your questions to me, and I'll see if I can track down some answers offline that I could send back to you. Okay, thank you everyone for joining us today. We will see you again next week at 11 a.m. Wednesday. Everybody have a safe and healthy week, and we'll see you soon.